First question that we wanted to ask you then was if when you were younger, this is what you wanted to do or what you wanted to do, and kind of your path from that to who you are today.
Yeah, so when I was younger, I actually wanted to be a pediatrician because every time I went to the doctor's office, the doctor had candy. And I thought, I'd like to be the doctor so that I can have candy all the time. So definitely not the right motives early on for getting into health. But as I grew older, I actually became really interested in disparities in health and really interested in HIV. And so I decided I didn't know anything about epidemiology at the time. And so I was thinking, oh, if I wanted to do health and I wanted to do, and I wanted to study HIV, then I have to be a physician. And it wasn't until I was in university, I was probably in my second year, I took a class with a professor and he had these three letters behind his name, MPH, and I wanted to know what that meant. So, and he was a physician, so I spoke to him and he said it's a master's in public health. And that's when I was introduced to public health. I was probably 19 years old before I even heard that public health was a thing, that it existed. And ever since, and then I was telling him about these reports I was reading, and he was telling me, oh, those are epidemiology reports about HIV. So then I discovered what epidemiology was and started reading in that area. And so after I finished my undergrad, I decided I didn't want to go to medical school. I wanted to be I wanted to study public health. I think I wanted to be an epidemiologist, but I wanted to have some exposure. So I did a graduate certificate in public health. And then I really loved epidemiology. And so I decided to do a PhD in that area. Still with a focus on HIV and my interest in HIV, I was always interested in social determinants of health and also in HIV. And I found that studying HIV was the perfect topic for combining all of my interests and looking at complexities. I mean, we're talking about an infectious disease, but it's now also a chronic infection and people are living full lives with HIV. And it also has these social dimensions. When you look at, especially in the Canadian context, the groups of people who are most at risk, the risk in the general Canadian population is quite low. But when you look at certain populations, like Indigenous populations, Black populations, men who have sex with men, injection drug users, the risk is much, much higher.
Thank you for that. That's such a really interesting pathway, how it changed along the way. And I think it does change for a lot of people. Pediatrics is something that comes up very often as the person, especially for women, like their first career and then it kind of switches. I'm just curious as to how you came to be the main epidemiologist for Prince Edward Island, kind of your pathway into that as well.
So it's actually quite funny. I was living in downtown Toronto and I wanted to move to an ocean. I wanted to move to an ocean and I was looking at a position in Vancouver with a private company. And then a recruiter from Prince Edward Island contacted me. And I thought, well, I wasn't sure I wanted to leave the public service. I was working in public service before. I wasn't sure if I wanted to leave public service entirely. And I was like, well, in this job, it's within government. I'd never worked in government before, but it is public service, which I really like. It's a provincial epidemiologist, so really having a broad scope and really being able to impact health and health policy. So that was a major plus. And the ocean was like the one requirement. It had to be on the ocean. And one of my previous bosses, when I told her I was moving to Prince Edward Island, she said, that's very adventurous. So I guess I'm very adventurous.
Well, it definitely is a change, I imagine, living over there. I've only been to visit, but it does have a beautiful sea.
I would say it's been one of the best adventures I've been on. Moving to Prince Edward Island. It's a beautiful place. It's a magical place to live. And now that I have a little one, like it's an amazing place for him to grow up. And so I think it was a fantastic move. And with an incredible team of colleagues in our epidemiology team and also within the Chief Public Health Office here. Again, a small but mighty team in public health.
That's great. And I'm pretty sure they're happy to have you there as well. So it's a win-win on both sides. I guess now that you're talking about your experience, my next question would be, what would you consider is your biggest achievement or the one that you're most proud of in your professional
My
career?
biggest achievement was actually completing my PhD. And it's because that's the achievement from which all kinds of opportunities have come, and all kinds of leadership opportunities have come. And I found that as a woman of color, if you want to be in leadership, it's strategically beneficial to have the highest degree you can attain in your field, because then you have the credentials, and to have those credentials from a reputable institution, because at least you can specifically point to those things to say, yes, I have expertise in this area, and I'm speaking with authority in this area.
That makes sense. And that kind of links a little bit into the next question, which was obviously your career is one of success, but along the way, did you encounter any barriers to your success or growth as a Black female leader?
Yes, I did. I remember there were times and I had mentioned this a few times I'd spoken to leaders in those organizations a few times and mentioned these instances specifically. Like I remember there was an instance I was working with an organization and we were working on a project. And I was the most senior epidemiologist on that project. The rest, I was the only person of color on the project team. And we had a discrepancy. And I think it was like 4 people, and then I was number 5. So it was like 4 and then 1. We had a discrepancy, and my colleagues, we all decided that we will reach out to some other epidemiologists who are well versed in the methodology and see what they say. We reached out to 3. We said an uneven number, so that we'd have someone who would be a tiebreaker. And we crafted an email together. I wrote the email, the rest of the team reviewed it, revised it, then we sent it out. We had our decision criteria laid out. 2 of the 3 epidemiologists responded and agreed with the approach that I had suggested. And they wrote lengthy explanations as to why. And then one epidemiologist responded and wrote a one-liner and didn't agree with me. And it was interesting because the team, they chose to reach out specifically to 3 older white male epidemiologists. And then our decision rule was we would go with what the majority said. So 2 agreed with me. And then the team said, well, we should change. They said there was something wrong with the email. So here we are changing the decision, moving the goalposts. And I found that, and that was an instance in which what I found it was a barrier to my leadership is, here is a team. And I mean, it's interesting that they chose 3 older white males, and I was a young Black female. And being able to gain the respect that was required, I found that was one of the biggest barriers. That project, I ended up leaving the project team, and I spoke to the head of the organization and told him why. And I said, I'm not sure if it's because I'm Black, because I'm female, or because I'm young, or maybe it's a combination of these identities, why the team just feels as though I am not qualified to speak on these topics. I said, because it's definitely not my education. I've been educated by top-ranking institutions, including Ivy League institutions in North America. I have a PhD, so it's not that I don't have the credentials. I've worked in this area for years, so I have the knowledge that's required. So on those objective factors, there is no reason why my credibility on this topic should have been questioned.
Yeah, that's really frustrating, especially since this is not like a once, like it's not just an experience that you have had. It's something that happens constantly to a lot of leaders that are trying to emerge, and then they don't end up being able to like continue on because of this. However,
And so for me, it was a position that I ended up playing a role in crafting that position. I already left I left an organization that I really loved to take on this other role. And so for me, it became a detour career-wise because I was not going to stay in an organization as I wasn't being respected. Um, and so I ended up leaving and taking another role where I had less autonomy. And so for me, that seemed like a step back because I had less autonomy than I did before. And so for me, it was instead of progressing, I ended up taking a step back, but I was adamant about not staying in that situation.
Yeah, that's really it's a shame that it still happens like in today's world.
Yeah.
People don't really talk about it. They assume that like, we are, especially in health, equality has been reached, but the truth is that this happens still. And I think what I'm curious about then would be over time you were able to overcome this. Now you're definitely in a place where you are
Yes.
happy in a leadership position. So, in what ways can fellow Black female leaders that are encountering these barriers um, kind of break the barriers and be able to reach that next level?
I think mentorship is really important and allyship. Those are the two important factors. Very often when we're in organizations, if we're in a leadership position, we're probably one of one in terms of women of color, Black women specifically being in those positions. I was in a large organization, and there were there was one. I saw one. It was an organization of over 1,000. I think we had 1,200 employees, and it was in health. And there was one Black woman who was in a leadership position somewhere else in the organization. I never got a chance to meet her. I saw her at a staff meeting, and then I was the other one who was in a leadership position. Um, and so there were no other Black women. There were a few women of color that you could reach out to, but no other Black women who were there. And in terms of in my situation, I had my manager, the person I reported to, was a very strong leader, an excellent mentor. And she was a white woman and she was an ally. And she helped to make sure that I was getting the opportunities and getting the recognition that I needed to be able to move to the next level.
It's really important to have mentors that, experience the same thing as you do. And that's why it's important to build leaders so that we have mentors
Yeah.
for the next generation as well.
And
Like we were, oh,
she
go
helped to
ahead.
make me feel very comfortable in having authority.
Mhm,
And she said, it's my ship to sail.
mhm.
Um, it's my group to lead, and she would support me. And so I learned immensely from her.
I do believe that mentorship is super important. I guess that leads us a little bit into the next question, which is from the fellow mentors that you've had in your career, what are some of the key attributes or qualities that you think are important for women in leadership, especially for Black women in leadership to
I
have?
think it's really important because for each woman, her experience with leadership is going to be different. And very often, it has to do with her lived experiences, her social location in relation to the team that she's leading, and many other factors. And so, what I found is what's helpful is to have a network of supporters, people from whom you could gather advice. Um, because no two women's situation is exactly the same, no two women's experiences are exactly the same. But if you're able to get various perspectives and people willing to share their own experiences with you, then at least you have a collection of ideas from which to choose what's most appropriate for you. Instead of our mentors being very directive, help us to gather information so that we can make the best decision for us. And I think the uplifting each other, supporting each other, promoting each other, I think those are important. I can say that in my career, I have been supported and uplifted and promoted by other Black women who are more senior in their careers. So there are opportunities that they would recommend that I take. Or if someone was invited to speak or to facilitate a dialogue and they were not able to do it, they would ask me if I would be willing to do it. And that would help me to gain exposure and that would help me to gain that experience. Um, there are other women who have championed me, who've seen me in action and have championed me and said, Shamara should be nominated for this. Or even recently on one of my research teams, on my main research team, there was a woman who is a full professor and very quite senior in her career. And we had a principal investigator who was stepping down, and she put my name forward saying I should be selected to replace that principal investigator. And so it's that kind of support that I found, that kind of practical support that also helps.
Perfect. Thank you so much for that as well. And moving a little bit into the consequences or the impact of leadership that is representative, what do you think is the current situation with Black women's health and research, and um, how are they being taken care of by the healthcare system and represented through research?
Very often we're underrepresented. There is a lot that we don't know about Black women's health at all. And it's in part because we aren't collecting data. We aren't collecting detailed sociodemographic data that gives us information about race, that gives us information about other dimensions of equity that intersect and impacts our health. We don't have good data on social determinants of health, even though we've said those are priorities. We still don't have good data in those areas. So the lack of data makes it really difficult to speak definitively about what the issues are. But some of the issues that we know are, for example, cancer screening for Black women, and or outcomes when it relates to cancer are not as good as for our white counterparts. Our screening rates are not as high. We know that maternal mortality and infant outcomes as well, Black women don't fare as well. We have data from the US and the UK. We do not have Canadian data. We don't have Canadian data that is disaggregated by race. So we're not able to say definitively in Canada, but what we do know is each and every time we've seen trends in other countries, I should say very often when we've seen trends in other countries, when we finally take a look in the Canadian context, we see those trends here as well. So it doesn't mean that those trends don't exist. We're just not looking at those trends because we don't have the data. When we look at obesity and diabetes within Black communities, among Black women, we don't have good data. Reproductive care issues, gynecological issues, like uterine fibroids, we know those are more common among Black women, but we don't have a lot of data, especially not race-specific data. So a lot of the conditions that affect other populations of women affect Black women as well. And there are some conditions that are more prevalent or even less prevalent among Black women. But again, we don't have good data. And I would say even HIV is an area where I've spent a lot of time in the past 2 decades working in this area. And I would say, like, I chose HIV as the area I would work in because when I was reading those reports that I didn't know were epidemiologic reports, I saw that the face of HIV was Black women, especially young Black women. And I was like, I fall in that demographic group. I need to do something about this. And that's an area where we do have some data. And because we have data, we've been able to see the disparities. We've been able to identify that Black women are facing a disproportionate burden of HIV, and then we can do something about it. And so we have organizations like Women's Health and Women's Hands Community Health Center in Toronto, and they have a program focused on HIV, and they do research around HIV and their Black women clients. And so if you have the data, then you can advocate. And through advocacy, you can have program and policy changes, and you can have organizations that are dedicated to addressing these issues. But without the data, we don't have the evidence that we need to make decisions.
For that answer. It was so perfect, especially since like a lot of students right now that are like probably seeing this within our members might not know that like even as they study, a lot of the results that they're looking at in classes are based on like a white male demographic, and that,
Mhm.
basing that and applying it to everybody is actually going to hurt a lot of people like you mentioned. And a lot of your research, I think, is really going to be able to help that by taking that step and being able to address the problem.
Yeah. And I think also it's important to recognize. So when I was doing my PhD, I had to justify. I spent lots and lots and lots of time justifying why I wanted to look specifically at Black populations and health in Black populations. And it was because there was this reluctance to look at race and also some discomfort there, right? And so that's a barrier that I think that's a barrier that has been created that has made it very difficult to collect the data, is that we have institutions that are uncomfortable, and leaders and institutions who are uncomfortable with collecting that data, which also speaks to the need to have more diversity represented in that leadership, because then you have different voices and people with lived experience whose voices can be at the table and can advocate, because that's where the decisions are made.
For our members watching this right now that, sorry about that, that are kind of thinking about, are getting inspired, want to pursue that leadership, what sort of advice would you give to someone that wants to pursue a similar career path to yours?
Do not shy away from leadership roles. You may be nervous. I used to be very quiet. I wouldn't say shy, but quiet and reserved. I probably still am. But when I'm asked to lead, like, I step up and I take that role seriously. And in the beginning, it felt overwhelming because I hadn't led before. But once you start leading, once you start raising your hand, you start volunteering to do things, you start taking on leadership roles, it becomes easier and easier and easier. Because then you start building that confidence, and confidence is so important. We have to believe in ourselves and our abilities. We have to be confident that we can achieve our goals. And we have to step into those leadership roles, not shy away from them. If you're asked to give a presentation, step into it, step into that opportunity and give that presentation the first time. Maybe it doesn't go as well. Maybe you're a little nervous and your voice is a little shaky, and that's happened to me before. But with time, it becomes second nature, and you become more comfortable and you start to shine as a leader. So it's important to lead. Take every opportunity you can to lead. And I would say also connect with other women, because sometimes you'll have experiences and you just want to scream out of frustration, or you've experienced blatant discrimination and you need to speak to someone. And sometimes you experience blatant discrimination and you're in a position where you're not in a position of power. And maybe it's from someone who's more powerful, who's an authority figure. And sometimes you just need other people that you can speak to, get it off your chest, get ideas about how to move forward. And it helps if you're connected with other women, other Black women, other women of color, other white women, to be able to share those experiences. And I would say also be an ally. Be an ally for others. If you see an injustice and you're able to speak up, speak up. We are all able to be allies. And it's important to give as much as we receive, right? And so not just always being the group in need of support from allies, but being an ally, or being allies ourselves and supporting others. If you see another woman or you see another person who is being mistreated and you're in a position to speak up, speak up.
I think that's very important. And like through your path towards leadership and through anyone's path towards leadership, it's not like a shiny road. There's going to be difficulties. There might be failures along the way. So,
Yeah.
in your personal experiences, how would you say, or what strategies did you take to continue moving forward, even as your ideas or personal goals were told to be impossible by others?
Well, I'm good at taking no as an answer. And so when I hear a no, I see that as a problem to be solved, and a situation in which I'll need to persuade someone so that they will say yes. And so, like, for example, when I started my PhD, I was supposed to work on an entirely different project. And I decided, well, I'm going to work on a project focused on HIV in Black communities. And that's what I'm going to do. And I was told, well, all of the barriers to working on that project, I was told you have to get your own funding and all of these different things. And I thought, well, I guess I'll just have to find my own funding. I'll write the grant applications. So it's having that attitude of, okay, this is a problem to be solved. Let's see how this problem can be resolved, and then we can move forward and have this project. And I think that persistence has been really important in my career, because it's helped me to achieve everything that I've achieved today.
Thank you so much. And yeah, I think that's something that a lot of leaders have in common. They've like pushed through the difficulties. So thank you for sharing your methods for
Yeah,
doing
and I
that.
think also finding good collaborators, because sometimes you have a problem and someone else has that same problem, and you could work together to solve that problem for both of you. And sometimes they have ideas that you haven't thought of, and so you have that exchange of ideas, and you build on each other's ideas, and you work together and solve the problem. So collaboration, persistence, and collaboration, I would say, are two key things.
Collaboration. And you did mention before that it's important to join with your community of fellow women. So I
Yes.
think that is something that helps along the way as well. We're almost at the end of the interview. The last question I would have for you is if you have any parting words with the members that are watching this, if you had to choose one takeaway from today that they will carry with them going forward in their lives, in their careers, what would it be?
I would say we have an opportunity to change the face of health and change the face of health leadership. And we know that there are now more women who are coming out of school with health degrees. We know that there are more women of color coming out of school with health degrees. And so it's up to us to keep pushing, keep supporting each other, forcing doors open, not politely knocking on the doors, but forcing doors open, making sure that we are prepared and ready to take on those leadership roles when they do arise. So continue your education, go as far as you can go, as far as reasonably possible for you, so that you are, and get as much experience as you can, so you are ready when that opportunity arises. You're ready to jump on it. You're ready to raise your hand and say, yes, I will lead, and step into that leadership role. And don't forget other women who are coming up behind you. Mentor someone, like always try to pay it forward. Mentor someone, bring them along with you, open doors for them, pass on opportunities to other women.
I think that's very important, and it's something that you're doing, and it's something that was done for you. So it's kind of like you pass the baton on to the next generation, and that's how
Exactly.
we like
And we
change.
elevate and uplift each other. And I mean, we are in the position to change health leadership, where we have a more representative health system and a more representative leadership for that health system. And we should support those changes.
Perfect. Thank you so much. So that is the end of the interview. So interesting. Thank you so much for all your answers. I already got inspired
Oh,
on my
good.
side.
I'm paying it
So
forward.